Did you know that one small nighttime habit could silently increase your risk of stroke, especially if you're over 60? No warning signs. No pain. No alarm. You go to bed feeling fine, and after just one night's sleep, you wake up unable to lift your arm, your speech is slurred, or your balance is gone. Over the past decade, researchers have repeatedly warned that certain habits, often thought to be healthy, may actually pose serious risks to the aging brain. According to the National Institute on Aging, some behaviors related to supplement use have been linked to a rising number of silent strokes in adults over 60, especially during the night or early morning hours, when the brain is most vulnerable to blood pressure changes, vessel constriction, and reduced circulation. The problem is, these are products millions of seniors take every day, believing they help boost memory, increase energy, protect bones, or slow aging. But few realize that when taken in the wrong dosage or at the wrong time, these health boosters can become silent threats to the brain, increasing the risk of brain bleeds, blood pressure spikes, or clots that lead to strokes, all while you sleep. In this video, we'll uncover the hidden dangers behind common health habits many older adults trust, and what you can do instead to truly protect your brain. This isn't about fear, it's about empowerment through understanding. Niacin, the heart vitamin that can spike your blood pressure. Let's kick off with one of the most surprising culprits, a vitamin often praised for heart health, but that can secretly destabilize your blood pressure and brain. We're talking about niacin, also known as vitamin B3. A vitamin you might have taken, or been told to take, for your heart. Niacin is often praised as a natural way to lower cholesterol. Some doctors even prescribe it. You'll also find it in heart health supplements, energy drinks, and fortified cereals. But here's what's often left out of the conversation, especially for older adults. Niacin in high doses can quietly cause serious swings in your blood pressure, and even trigger a stroke. Let me introduce you to Mr. Thomas Miller. He's 82, a retired postman from Florida. He came to see me with a strange mix of symptoms: hot flashes in his face, a pounding sensation in his chest, and dizziness that came and went every morning. His wife thought it was anxiety. His son blamed it on his blood pressure meds. But the real cause? Something no one had thought to check. Dennis had been taking an over-the-counter heart-healthy supplement. The front label said supports cholesterol and circulation. The back? 1,000 milligrams of niacin per serving. He was taking it twice a day. That's 2,000 milligrams daily, over 60 times the amount most seniors actually need. Here's what happens when you take niacin in high doses. It causes your blood vessels to suddenly expand, which is why your face may flush or feel warm. But shortly after, those same vessels snap back and constrict. That sudden tightening can raise your blood pressure, stress your heart, and reduce blood flow to your brain. Over time, this yo-yo effect is like tapping a hammer on fragile glass. Eventually, something gives. Dennis had what's called a transient ischemic attack, or TIA. A mini stroke. His speech slurred for 2 minutes, then returned. He thought it was a fluke. I had to tell him the hard truth: his daily supplement meant to help his heart was quietly harming his brain. And he's not alone. Many seniors take high-dose niacin without even realizing it. They buy flush-free or extended-release forms online, thinking it's safer. But even those versions can still raise blood pressure, trigger atrial fibrillation, and affect blood sugar levels. Here's what you need to know: for older adults, anything above 50 milligrams of niacin per day should be used only under medical supervision. And if you have high blood pressure, heart rhythm issues, or are on medication, please check your labels. Dennis is now off niacin. He's recovering, no permanent damage. But he told me something I won't forget. Doc, I thought I was doing everything right. I didn't know I was gambling with my brain. Vitamin A, from vision protection to brain pressure. Next, let's turn our attention to a vitamin best known for its role in vision, but one that can silently raise pressure inside your skull, with symptoms that mimic a stroke. That's vitamin A. If you're like most older adults, you've probably heard that vitamin A is essential for good eyesight. Maybe you've even taken it for your immune system, skin health, or because someone said it helps you age gracefully. But here's what almost no one tells you, especially if you're over 60, too much vitamin A doesn't just sit quietly in your system. It builds up. And over time, it can increase pressure inside your skull, mimicking a stroke, damaging your vision, and even affecting your brain. Let me tell you about Miss Susan Simmons. She was 79, a retired piano teacher from Oregon. She loved music, taught students from her living room, and took pride in staying independent. But one day, she started getting headaches. Then came the blurred vision. Then the dizziness. And the slurred speech. Her family feared the worst, a stroke. But when we ran her scans, something surprising showed up. No clot. No bleeding. Instead, she had elevated intracranial pressure, too much pressure inside the brain. Her spinal fluid was backed up. Tiny veins in her brain were under stress. The cause? Vitamin A toxicity. She'd been taking a high-dose skin and eye supplement for over 5 years, nearly 10,000 IU per day, every day, without realizing it. Here's the key difference: vitamin A is fat-soluble. That means your body stores it, in your liver, your tissues, even your brain. It doesn't flush out like vitamin C or B. And as we age, our liver slows down. So that buildup happens even faster. When there's too much vitamin A in the body, it can lead to a condition called pseudotumor cerebri, a false brain tumor. The symptoms: headaches, blurred or double vision, dizziness, nausea, even permanent vision loss or cognitive decline. The tricky part? Many multivitamins already contain the full recommended dose of vitamin A, but some people, like Ms., unknowingly double or triple that by adding skin, eye, or anti-aging formulas on top. The safe upper limit for seniors? Roughly 2,500 to 3,000 IU per day. And that's only if needed, under medical supervision. But many supplements sold online contain 5,000, 10,000 IU or more, taken daily, for months or years. It's easy to see how the damage builds up. Ms. is slowly recovering. But she now needs regular eye exams, pressure checks, and balance therapy. She told me, "I thought I was doing something good for my body. I never imagined it could hurt my brain." And that's why I share her story. Because it's not about scaring anyone. It's about making sure you have the facts, so you can protect yourself and your independence. Vitamin B6, the popular nerve pill that can secretly damage your nerves. It's often labeled as a brain booster, a nerve protector, or an energy enhancer, but in reality, one common vitamin can quietly dismantle your nervous system if taken in the wrong amounts. I'm talking about vitamin B6, a supplement millions of older adults take daily without a second thought. It sits on pharmacy shelves in bold-colored bottles that promise focus, circulation, and sharper thinking. But here's what almost no one tells you: in large doses, this vitamin doesn't help your nerves, it harms them. Let me introduce you to Mrs. Pauline Richards, a 78-year-old retired dance teacher from Georgia. For decades, She taught ballet with grace and energy. But over the past year, she noticed her feet tingling. Her steps felt uncertain. Then one day, she stumbled during a morning stretch and fractured her wrist. At first, she blamed aging. But when we looked at her supplement list, the truth came into focus: a daily nerve and memory pill with 150 milligrams of vitamin B6 per tablet, taken twice a day, 300 milligrams daily. That's more than 15 times the upper safe limit for someone her age. Here's what's dangerous: vitamin B6 builds up in the body over time, especially in seniors. It doesn't flush out easily like other water-soluble vitamins. Instead, it slowly accumulates in tissues, stripping the protective sheath off nerves, just like peeling the insulation off electrical wires. The damage? Burning sensations, loss of balance, muscle twitching, even confusion that mimics early dementia. And it gets worse: most of these symptoms develop gradually. People think it's just arthritis, or getting older. They never suspect the cause could be something they bought over the counter. Mrs. Richards was lucky. We caught it in time. The pills were stopped, and her symptoms stabilized, but she now walks with a support cane and lives with lingering tingling in her toes. If you're taking any product labeled nerve, brain, or energy, I urge you, check the label. Seniors typically only need 2 to 10 milligrams of B6 per day, and that includes food sources. Anything more should be discussed with a doctor. Because when it comes to your nervous system, too much of a good thing can quietly become a lifelong burden. Vitamin E, a heart-healthy antioxidant or a hidden risk for brain bleeds? Moving into a vitamin many seniors take for cardiovascular support, we come to vitamin E, a supplement that, in certain cases, can turn from friend to foe, especially when combined with blood thinners. Vitamin E, often called the heart helper. If you've been taking it for years, you're not alone. Many people over 60 add vitamin E to their routine, hoping it'll support their heart, improve circulation, maybe even boost memory and skin health. But here's the part that doesn't make it onto the bottle label: too much vitamin E, especially when combined with common heart medications, can increase your risk of bleeding in the brain. Yes, even if you're doing everything right. Let me share a story I'll never forget. Mrs. Evelyn Brooks, 81, a retired librarian from Ohio. She was sharp, witty, and always had a book in hand. She had a heart valve issue and was on warfarin, a common blood thinner. Her doctors monitored everything closely. Her blood work was fine. Her pressure was stable. But one day, she picked up a bottle of natural vitamin E she saw advertised in a magazine. 800 IU per capsule. I thought it would help my memory and circulation, she told me. 3 weeks later, she was rushed to the ER with a terrible headache, confusion, and vomiting. A brain scan showed a hemorrhagic stroke, bleeding inside the brain. Not because of high blood pressure. Not because of a fall. But because the combination of warfarin and high-dose vitamin E had made her blood too thin to clot. Just one fragile vessel in her brain gave way. Here's what most people don't realize: vitamin E in high doses works like a natural anticoagulant. That means it slows clotting. If you're already on aspirin, Plavix, or any blood thinner, and then add vitamin E, your risk of internal bleeding quietly goes up. Especially in the brain, where even a small bleed can steal your speech, your memory, or your ability to walk. And get this, the recommended daily intake for older adults is just 15 milligrams, about 22 IU. Yet most supplements on store shelves contain 200, 400, even 1000 IU per capsule. No warnings. No consultations. And many folks take them every day for years. Mrs. Evelyn survived, but she now walks with a cane. Her short-term memory was never quite the same. She told me through tears, "I just wanted to help myself. I didn't know I was doing harm." And that's the part that breaks my heart. Because she's not alone. So many seniors think if it's a vitamin, it must be safe. But the truth is, not every vitamin is safe. Especially when you're on heart or blood pressure meds. You must talk to your doctor before adding anything new. Vitamin D, the beloved sunshine vitamin that can turn against you while you sleep. And finally, we end with perhaps the most widely used supplement among older adults, vitamin D, often seen as beneficial for bones, mood, and immunity. This vitamin, when taken improperly, can quietly push you towards stroke without warning. You've probably heard that it's good for your bones, your mood, even your immune system. And that's all true, in moderation. But here's something most seniors are never told: too much vitamin D, especially taken at night, can quietly raise your risk of stroke. I know that sounds shocking, but I've seen it with my own patients. Take Mr. Walter, for example, a 74-year-old retired Navy vet. He was sharp, disciplined, and took his health seriously. Every morning, like clockwork, he lined up his supplements, including a 10,000 IU vitamin D capsule he bought over the counter. He believed he was protecting his bones, but what he didn't realize was that this simple routine was slowly pushing his body toward a silent disaster. One morning, his wife found him confused. He couldn't speak clearly. His right arm hung limp. A stroke. Overnight. His labs showed dangerously high calcium levels, stiff arteries, and blood pressure all over the place. The culprit? Vitamin D toxicity. You see, when you take high doses of vitamin D, especially without medical guidance, it causes calcium to build up in your bloodstream. And your body doesn't know what to do with all that extra calcium, so it sends it into your arteries, making them stiff and narrow. And guess where that can lead? A blood clot, straight to your brain. As we get older, our arteries naturally lose flexibility. Add in dehydration, poor sleep, and a calcium spike at night, and you've created a perfect storm for stroke. The scariest part? There are no warning signs. You go to bed feeling fine and wake up with your life forever changed. And here's something you may not know. Many over-the-counter vitamin D supplements in the US contain far more than older adults actually need: 5,000 IU, 10,000 IU. People take these every day thinking more is better, but studies show that even 2,000 IU daily may be too much if you're not deficient. Let me say this clearly: if you're taking vitamin D, especially along with calcium or heart medications, it is crucial to get your blood levels checked regularly. And always take it in the morning, not before bed. After learning about how common vitamins can quietly harm the brain, many older adults ask me, if not supplements, then what? It's a wise question, because your body was never meant to run on synthetic pills. It was meant to thrive on food. Real, whole, living food, rich in the nutrients your brain understands, craves, and can use exactly as needed. Let me tell you about Mr. Thomas Rivera, a 75-year-old retired math teacher from New Mexico. When he came to see me, he brought along a zippered pouch filled with supplements. Vitamin A for vision. Vitamin D for immunity. B-complex for nerves. Niacin for cholesterol. He even had an herbal blend for memory. I've been doing all the right things, he told me. but he was tired every afternoon. His head felt foggy, and his blood pressure spiked unpredictably. Something wasn't quite right. So we made a shift. We closed the pouch. And we opened the fridge. Instead of chasing wellness in bottles, we built it through his plate. No superfoods. No exotic powders. Just clean, real ingredients and combinations that nourish the aging brain. Here's what his morning meal looked like: 1 soft-boiled egg, gentle on digestion, strong on protein. A few slices of avocado, for essential fats that coat and protect neurons. A small bowl of steel-cut oats with cinnamon, for steady blood sugar. A handful of raspberries, for anthocyanins that calm brain inflammation. A glass of warm lemon water, to rehydrate after sleep. On some days, he'd sprinkle chia seeds or add a spoon of plain Greek yogurt. That's all. No capsules. No confusing labels. Just honest nourishment. Within a month, Thomas noticed the difference. His clarity returned. His energy stretched into the afternoon. His pressure readings leveled out. "It feels like I'm finally feeding my brain what it's been asking for all along," he said. And science backs this up. The aging brain needs hydration, essential fats, fiber-rich carbs, and micronutrients in their most natural form. Not in megadoses. Not from isolated chemicals. From food that speaks your body's language. Some of the most powerful foods for seniors include dark leafy greens, brimming with folate and brain-friendly antioxidants. Omega-rich fish, like trout, sardines, or salmon. Bright berries, for their polyphenol. Nuts, for vitamin E and magnesium. And hearty whole grains, for vascular support and mental stamina. Because when you eat with intention, you're not just feeding your body. You're fueling resilience, clarity, and independence, with every delicious bite. Your brain is one of the most powerful organs in your body, and also one of the most delicate. As we age, even the smallest daily choices, from the supplements we take to the time we take them, can have lasting effects on our health, for better or worse. What seems like a harmless vitamin may quietly shift the balance, increasing the risk of stroke, nerve damage, or cognitive decline without a single warning sign. But the good news is, awareness gives you power. When you understand what your body truly needs, and what it doesn't, you take control of your health, one informed decision at a time. It's not about fear. It's about clarity. And the truth is, you don't need megadoses or miracle pills. You need real food, smart habits, and science-backed guidance. If this video opened your eyes, share it with someone you care about. It might help protect their brain too. And if you want more honest, practical tips designed for healthy aging, don't forget to like this video and subscribe to our channel. Together, we're building a smarter, stronger, and safer path to lifelong wellness. You're never too old to take back your power.